Hi everyone, welcome to Nursing Guru. Today I am dealing with the topic bed making. As you are nursing students, you may be dealing with a lot of clinical practice procedures. One of the most important procedure among them, that is the bed making. As a nurse or as a nursing students, we have to prepare the bed of the patient every day, even before admitting the patient or after discharging the patient, or even for many of the procedures. So let's learn in detail about bed making. Let me begin the topic. Coming to the introduction, what do you mean by bed making? Actually, bed is a piece of equipment which is used in hospital for hospitalized patients, provide comfort as well as rest to those patients. We may provide this bed or we may make or prepare this bed either for long-term care as well as this bed could be prepared in their home too. That is the just introduction of this bed making. Coming to the definition, bed making is preparing different types of bed in order to provide comfort to the client or the patient, and also to provide some of the situations or positions that are required for certain conditions. That is the definition of the bed making. Here we are actually preparing some different types of bed. That is, the main purpose is to provide comfort to the patient as well as in certain conditions or in certain disease conditions or in certain surgeries, the patient have to maintain some positions that we can provide by preparing this bed. Next, we will move on to the purpose of this procedure. The main purpose of this bed making is to provide comfort to the patient and to provide rest to the patient. And also the second one, that is to maintain the unit or the ward neat and tidy. If we prepare a bed neatly or in a comfortable manner without any wrinkles, that makes the unit neat as well as tidy. And the third main important purpose is to economize the material, the energy or the effort and the time. In order to economize or save the material, the time as well as our effort, we can do this bed making procedure. Then the next important purpose is to adapt to the needs of the client. That is, a client may have different sorts of needs. So in order to adapt to those needs and also to get ready for some of the emergency conditions or in critical illness stages, in order to prepare that bed, we can follow this bed making procedure. The other most important purpose that include to prevent cross infection to the client and also to prevent bed sore. That is, if the patient is lying in bed for a prolonged period of time, he may get or there is an increased chance for development of bed sore or pressure ulcer or decubitus ulcer. So in order to prevent that, we can prepare a neat and tidy and wrinkle free bed. That is the other important purpose of this bed making. So these are the major or important purpose or aims of this bed making. There are some of the general instructions that should be followed while preparing a bed. Some of the common general instructions to be followed that include, we have to ensure proper hygiene of the hands. That is, first and foremost thing we should do is hand washing. Proper hand washing should be done before and after the procedure. That is not only to provide safety to the client but also to protect ourselves from infections. And the second most important instruction that include, we should never make the patient lie on the lay bed. That is, we should never make the patient lie just on the Macintosh, and above the Macintosh we should spread a draw sheet or top sheet should be spread. Only that patient should be laid down on that sheet and the patient should never lie on the Macintosh alone. And the third one, coming to the third one, that is, we should never allow the soiled linen and the neat and tidy or fresh linen to get or mix together. That will lead to infection to the patient as well as the nurses ourselves. And the next important thing that we should maintain is we should always maintain body mechanics. That is the first and foremost thing that we should take care of. We should maintain the body mechanics in order to prevent fatigue and as well as to improve the mechanism of our body. That is, we should keep wider the base of support that will give the greater stability. And the next important general instruction that should be followed, that include the patient should never lie on the blanket alone. That is, before keeping or before spreading the woolen blanket, above that we should, or below that we should spread a bath blanket. That is, the patient should lie on the bath blanket first, and above that we should spread the woolen blanket. These are some of the general instructions that should be followed while doing this bed making procedure. Next, some of the general principles that are included in this bed making procedure include: first one, microorganisms are present everywhere, even on the skin, on the articles used by the client, and even in their environment. So the nurse should take care to prevent transference of these microorganisms from the source to the new host. And also the nurse should take care to prevent multiplication of microorganisms. This is the first principle, that is, microorganism is present everywhere on the skin, articles used by the client, and even in the environment. So the nurse should take care to prevent spreading or transference of these microorganisms from the source to the new host, as well as multiplication, to prevent the multiplication of microorganisms. And the second most important principle include safe and comfortable bed, or safe and comfortable bed that is prepared helps to prevent complications in bedridden patients. That is, if you are preparing a safe and comfortable bed, that will help in preventing further complications in bedridden patients. That is, that will help to prevent bed sore or pressure ulcer or decubitus ulcer and food drop like problems. And the next one, maintain correct body mechanics. Maintenance of correct body mechanics will helps to prevent fatigue and work effectively. Last one, that is systematic way of functioning helps in saving time as well as material. These are the principles of bed making. Next, we will discuss in detail what is the procedures and what are the articles required for bed making. Some of the articles that is required for bed making include: we require a cot, then a mattress with a mattress cover, then a pillow with a pillow cover, then a top sheet, bottom sheet, drawer sheet, Macintosh, and a duster. That is to dust the or clean this bed. So, coming to the procedure, first of all, we have to remove the pillow and the pillow cover, and it should be placed in a nearby chair. And second thing we have to do is remove the top sheet. And after or while removing the top sheet, we should take care that it should be removed by folding it into the middle of the top sheet or middle of the mattress or the bed, and it should be folded into 3 or 4 pleats. After that, it should be taken and kept in the chair. Then what we have to do is we have to roll on the Macintosh, and it should be also taken apart. Later or after that, we have to gently or slowly remove this bottom linen, and the soiled mattress cover should be removed. After that, we have to start the procedure. Before starting this procedure, we have to clean the bed using the duster. Then we should first of all draw or spread the drawer sheet or the bottom sheet over the bed, and it should be tucked tightly from the or starting from the head end of the bed. Then we should always take care that we should start the tucking at the nearest side of the bed where we are standing. From there itself, that is the nearest side, we have to start the tucking. Then we have to go to the downward or to the foot end of the bed, and there we have to make mitted corners and tuck it properly. After that, we should roll the Macintosh, and it should be kept about 37 centimeter below the head end, or where we are placing the pillow. Below that, about 37 centimeter below, we should keep this Macintosh, roll on the Macintosh. Later, we have to spread the top sheet and the drawer sheet. The top sheet should be spread above the Macintosh, and it should be secured properly by tucking and using mitted corners. And each side of the bed should be tucked properly, and we should ensure that there is no wrinkles in that bed. And at last, we should always cover the pillow with the pillow cover, and it should be placed properly in the bed. This is how we prepare a bed. Next, we will discuss about types of bed. There are some different types of bed that we have to prepare. Let's look the type of bed. The first one is closed bed. Closed bed is an empty bed which is covered with top linen, to that all linen beneath the linen is fully protected from dust and dirt while waiting for the patient to admit. That is the closed bed. Then coming to the open bed. The term open is used to designate the hospital bed when it is about to be occupied by a client. It is made either for a new client or an ambulatory client. Next is the admission bed. It is special bed used for admitting patients. Bath blanket and bed accessories are some of the special requirements needed for preparing this bed. One of the purpose of making an admission bed is that it facilitates bathing of patients in bed without undue disturbance. The client gets into the bed after a bath and changing into hospital dress if it is a custom in the hospital. Next is the occupied bed. An occupied bed is available bed where there is a patient physically in the bed or the bed is being retained for a patient. The patient is receiving treatment is on leave. This is to make for a client who cannot get out of bed. That is bedridden patient. The preparation and aftercare of the client will be same as in an open bed. The next thing, that is a cardiac bed. This bed is made to help the patient assume a sitting position which can offer him or her greatest amount of comfort with least strain. The main purpose of cardiac bed is to relieve dyspnea caused by cardiac diseases. These are the some types of bed. The next one, that is operation bed or post anesthetic bed or recovery bed. This bed is made for those patients who have undergone surgery. The bed is made in such a way in that the patient become more easier and comfortable. Next is the fracture bed. This is a narrow extra firm bed for the treatment of fracture. Usually incorporates on overhead frame for traction. It's also some extra part of the bed and equipment. It uses for client with a fracture of trunk or extremities to provide firm support by the use of a firm mattress that rests on a fracture board or bed board. Next one is the amputation bed. These beds which are used by the nurse for the patient after amputation of the lower limb, where it is necessary to keep the stump visual and elevated, not to keep the stump visual and elevated. For example, this is used for the patient whose leg is amputated. So, let's conclude this topic. While concluding this topic, bed making is an essential procedure in nursing in which nurses prepare and arrange different types of beds for the client's comfort in the hospital or other healthcare institutions. So, bed making ensures patient's comfort according to the situation. It may vary on the client's condition, purposes and procedures such as open bed, closed bed, occupied bed, cardiac bed, fracture bed, admission bed, operation bed and amputation bed. These are the types of bed. So far we discussed about bed making, the purpose of bed making, the articles used in bed making and the types of bed. So, this is regarding bed making. Hope you all understood this procedure and this topic. And if you have any doubts, please comment just below on the comment section. Thank you.